Welcome to the Brooklyn Historical Society, where the vibrant history of Brooklyn is made tangible, meaningful, and relevant today. These videos feature inspirational highlights and excerpts from our teaching and learning materials. To find more resources about the history of Brooklyn, visit us online at www.brooklynhistory.org. This is the first video in a three-part series about the history of public health in Brooklyn. This video explores issues of sanitation, disease outbreaks, and the creation of the modern sewer system. In the mid-1600s to the mid-1700s, when the colony of New York was still under British rule, most residents got their water from community wells and streams. As the city of New York grew, residents of the island of Manhattan obtained water from Collect Pond. Collect Pond was a large, 60-foot deep pool fed by an underground spring that was once in present-day downtown Manhattan. By the early 1800s, however, the pond had become contaminated with garbage and human waste, also known as sewage, and was no longer safe to use. Before water closets, or what many of us call toilets, people used chamber pots, outhouses, or privies to go to the bathroom. A chamber pot was used inside the house and is a pot with a lid that was usually kept under the bed. In the middle of the night, on rainy days, or any time it was needed, a person would sit on the pot to relieve themselves, use a plant called lamb's ear to clean themselves, then place the lid back on the pot and put it away. At a later time, they would either throw the contents out of the window onto the street or empty the pot into an outhouse or privy. An outhouse is a bathroom located outside, similar to a modern-day portable toilet. Under the seat is a pit or a vault that contains all of the waste. Very different from our modern-day toilets, an outhouse is non-flushable, meaning there is no running water, and thus the waste materials remain until someone comes to take them away. Outhouse or privy vaults posed a serious threat as the contents, called night soil, were only cleaned out weekly. If there was a crack in the vault, the night soil would seep down into the water table and contaminate drinking water, which people accessed through wells and water pumps. Workers, called night soil scavengers, would come and clean out the privies and dispose of the night soil in local waterways, such as the East River, the Gowanus Canal, and other areas. As a result, waterways quickly became contaminated with illness-causing germs, and in turn, people and wildlife became sick. Soon there were epidemics, or widespread outbreaks of disease, that affected large numbers of people across the city. The cholera outbreak, for example, was caused by water contaminated with germ-filled human waste seeping into the water table through a nearby well. By the 1800s, New York was beginning to change rapidly. New York was no longer a small town, but was emerging as a large metropolis. With this growth, the city faced two distinct challenges: how to supply residents with more fresh water free from contamination, and how to deal with the growing amount of wastewater. Public health was declining. People were living in crowded and unsanitary conditions, and that made fixing the city's problems increasingly difficult and increasingly important. In order to build the city's sewers underground, many workers were employed to dig enormous holes or tunnels in the ground for pipes. The people who made the tunnels, all of whom were men, are called sandhogs and are known as the city's legendary urban miners. They built every tunnel in New York City, including the sewer tunnels that rid the city of its waste, the water tunnels that bring in clean water all the way from upstate New York, the subway tunnels for trains, and transit tunnels for cars and trucks. The sandhogs used massive drills and other tools to dig into the ground for the pipes. Working underground for hours at a time, these builders put up supporting structures to hold the ground around them in place. These structures helped to keep the newly dug tunnels from collapsing. While the development of the modern sewer system saw tremendous improvements in water contamination and decreased its related public health issues, water contamination can still be a problem in Brooklyn. The borough of Brooklyn today has two types of sewer systems. Some neighborhoods, such as Bergen Beach and Mill Basin, have what are called separate sewer systems. In a separate sewer system, there are dedicated pipes that carry rainwater directly to our waterways, and other pipes that carry contaminated water to the city's wastewater treatment plants. The majority of the borough, however, uses a combined sewer system, where wastewater and stormwater are combined in the same sewer pipes. In a combined sewer system, there is a dam that is designed to block sewage from going into our waterways untreated. Unfortunately, when there is too much water in the system, the wastewater can go over the dam and flow into the waterways. This is known as combined sewage overflow. For years, heavy rains have flooded streets and caused sewage lines to overflow, contributing to the contamination of waterways such as the Gowanus Canal. For more information about sewers, sanitation, and public health in Brooklyn, check out an episode of our podcast, Flatbush in Maine, titled Histories of Waste in Brooklyn, available on our website, www.brooklynhistory.org.